We are RSL Team 7, and here's our recommendations for Dispatch Health's healthcare channel partners.
My name is Dylan Epstein.
Mine is Faisal Hajri.
My name is Mia Fischelli.
My name is Josh Cagman.
And my name is Grace Lacrosse.
After my colleagues and I evaluated the four key criteria, we recommend that Dispatch Health form a strategic partnership with Humana Intermountain Health. These organizations align closely with Dispatch Health's mission and objectives, creating strong synergies that support long-term success. Their growth potential and target markets makes them ideal partners in ensuring that Dispatch Health can expand its reach and impact effectively. While financial attractiveness presents a minor challenge, it does not outweigh the significant strategic benefits of these partnerships. Overall, the alignments of interest combined with the opportunity for sustainable expansion makes alignment of interest combined with the opportunity makes Humana and Intermountain Health the most compelling choices for collaboration. Moving on to the comparative analysis, Humana is solid in target market and aligned interest, with a wide footprint and investment in affordability. Growth potential is strong, however, its financial attractiveness is moderate. Intermountain Health, it performs well uh, and aligned interests and growth potential and growing regional presence due to its non-profit purpose. Financial attractiveness is a visibly a minor drawback. Intermountain, it brings regional knowledge and recruits specialists to their growing network. Their only downside is a slightly lower payoff, showing us that the business model places Humana and Intermountain as the best partner candidates. That covers my part. Now my colleague Dylan will take it from here and dive into Humana's wellness.
Thank you, Faisal. We'll now dive deeper into why we recommend Humana as a channel partner despite its trade-offs. Growth potential is a very important metric because of its attractiveness to consumers and investors. We recommend Humana for a couple reasons. Humana aims to have 17 million members in its Medicare and Medicaid benefit plans by year end 2024. Although their nationwide Medicaid footprint is only expected to cover 9 states, their Medicare business is significantly outpacing the rest of the industry, covering all 50 states because of their shift from a health insurance company to a healthcare services organization. Humana has a strong focus on ESG to provide health, safety, and quality in its offerings, which is an attractive mission and values to more consumers. At its rate of growth and mission, we project more and more states to join its Medicaid coverage benefits and expand nationally. While we recommend Humana, Optum United Healthcare has a very strong potential for growth as it is a household name whose reputation will help it grow to new heights. While Humana is known, it is not to the extent of Optum and United Healthcare. Comparing Medicare and Medicaid benefits to a different channel partner, Kaiser Permanente solely focuses on private insurance and have an inability to capture Medicaid and Medicare patients, which hinders its potential for growth and makes Humana the better option due to its cast of a wider net. I will now pass it off to Grace to go over how Humana aligns with Dispatch Health's interests.
Thank you, Dylan. Humana and Dispatch Health share a commitment to improving healthcare accessibility, affordability, and outcomes. They also share a strong dedication to value-based care, and Humana already has direct involvement with Dispatch Health as an equity shareholder. Humana's core demographic, older adults and chronic care patients, overlaps with Dispatch Health's target market. Their mission includes expanding home-based care services, making them an extension of Dispatch Health's recovery model. Humana serves both Medicare and Medicaid patients across multiple states, ensuring broad accessibility for the patients Dispatch Health prioritizes. While other companies offer potential benefits, their priorities not fully align with Dispatch Health's mission. United Healthcare has significant market reach, but it prioritizes profit-driven insurance models, which does not align with Dispatch Health's focus on patient-first, value-based care. WellMed specializes in chronic disease management, which isn't aligned with Dispatch Health's post-hospital recovery services. Blue Shield and Kaiser only serve private insurance patients, which excludes a majority of Dispatch Health's patient base. Ultimately, Humana offers the ideal combination of mission alignment, patient focus, and long-term commitment to value-based care. I will now pass it over to Mia to talk about Humana's target markets.
Thank you, Grace. To expand on that, Humana is also a great option when it comes to target market because they have nationwide reach and established Medicare growth. Humana operates in all 50 states, meaning Dispatch Health can scale its services nationally without any geographical restrictions. Their Medicare and Medicaid programs are expanding rapidly and have a patient base that directly aligns with Dispatch Health's home care model. The average patient age is around 60 years old, slightly younger than the industry norm. While this means fewer immediate patients, it presents a long-term opportunity. Most Humana members take at least 3 medications, indicating ongoing medical needs, are socioeconomically stable, and have fewer than 2 serious diseases, making them ideal candidates for home-based chronic care management. Therefore, it's clear that Humana's massive reach, growing Medicare population, and financially stable members make them a strategic partner for expanding Dispatch Health services on a national level. While Humana is a strong partner, there are a couple of trade-offs to consider. First is the younger patient population. One of the key challenges with Humana is that, as I previously said, their average member age is only around 60 years old, which is younger than the industry norm. This matters because younger patients are less likely to need immediate post-hospital care, which is a major focus for Dispatch Health. However, this also presents a long-term potential, as these patients will eventually age and develop more chronic conditions. Next, Humana has moderate financial attractiveness in comparison to some of the other channel partners. For example, choosing Blue Shield would generate about $4,000 per visit. This is much more than Humana, making them a more lucrative partner financially. However, Humana is able to offset this with high patient volume, ensuring steady revenue. Despite this trade-off, Humana remains one of the best strategic partner for Dispatch Health. Now I'm going to pass it off to Josh, who's going to talk about Humana's financials.
Thank you, Mia. Humana might not be making the most per visit, but their contribution margin percentage is positive at 16.67% for Medicaid and 20% for Medicare. While Optum Health is the worst financially, with Medicare having a loss of $50 per visit, although their Medicaid program makes $50 per visit and the private program makes $450 per visit. WellMed is one of the best financially, with Florida having 33 and Texas having 43% contribution margin percentage. And Dispatch Health gets to keep 100% of the revenue as well. Now I pass it off to Dylan to introduce our second recommendation.
Thank you, Josh. We will now dive deeper into why we also recommend Intermountain Healthcare despite its trade-offs. When looking at Intermountain Health in terms of long-term growth potential, it is the largest nonprofit health system in the Rocky Mountain region. While this geographic focus isolates them from expanding nationally, their plan to reimagine healthcare and prominent legacy since the late 1800s will expand their patient count from 3 million to almost everyone in the region. Furthermore, their focus and connection to Catholic entities will appeal to a network of people all across the region, allowing them to expand in that way. When comparing channel partners in terms of its geographic footprint, we can look at WellMed and Blue Shield California. WellMed is well established in Texas and Florida, and despite its small footprint by area, there's still some room to grow its patient coverage. However, we feel that Intermountain still has a stronger platform to grow. Blue Shield California already services 4.8 million patients, but given its focus on just California and its dominance already, we don't see much more room for growth. With Intermountain, we still see that room for growth given its mission, its legacy, and the fact that its member population skews lower than industry averages. I will now pass it back to Grace to go over how Intermountain Health aligns with Dispatch Health's interests.
Thank you, Dylan. Intermountain Health and Dispatch Health share a mission-driven approach to healthcare. Similarly to Humana, Intermountain also prioritizes affordability, accessibility, and community. Intermountain operates as a nonprofit, meaning they prioritize health outcomes over financial margins. Their mission of helping people live the healthiest lives possible directly aligns with Dispatch Health's goal of improving healthcare accessibility through at-home recovery services. Intermountain prioritizes community health and affordability, ensuring that Medicaid and Medicare patients can receive quality care. This aligns with Dispatch Health's mission to provide care to diverse patient populations. Intermountain Health stood out compared to the other options. United Healthcare has a massive market reach but is highly profit-driven. WellMed is heavily focused on chronic disease management rather than post-hospital recovery. Blue Shield focuses on cost efficiency over patient care accessibility does not align with Dispatch Health's mission. And finally, Kaiser Permanente only supports private insurance members, restricting accessibility. Intermountain shares Dispatch Health's commitment to expanding access to home-based recovery, prioritizing community health, and advancing value-based care. I will now pass it on to Mia to talk about Intermountain's target market.
Thanks, Grace. When looking at the target market, Intermountain Health is a strong regional opportunity. Unlike Humana's nationwide reach, Intermountain Health offers a highly concentrated and engaged regional market with a strong healthcare presence. Intermountain operates across these 7 western states as dictated by this map. This limited geographic reach may be a trade-off to consider because it limits expansion potential compared to larger national networks. However, their deeply established regional trust and brand recognition makes it a reliable partner despite this trade-off. In addition to this, their target market is a strong fit for Dispatch Health. Just like Humana, the average patient age is around 60 years old. Most patients take 3 or more medications on average. Many patients have multiple chronic conditions, and their members are socioeconomically stable, ensuring more reliable reimbursement and financial sustainability for home healthcare services. All of this makes Dispatch Health's model more viable in the long run. Now I'm going to pass it back off to Josh to talk about Intermountain Health's financials.
Thank you, Mia. While Intermountain Health does make a loss on Medicaid visits of $13, for a private visit, they make $3,700, which we think more than makes up for the small loss on Medicaid. As you can see in the chart, Intermountain Health makes the most out of any partner for a private visit. Blue Shield California is the best financially because they get to keep 100% of the reimbursement, which is $4,000 per visit, more than enough to cover the variable costs. Kaiser Permanente is also financially attractive, even though Kaiser keeps 20% of the reimbursement. Dispatch Health gets $1,760 as their contribution margin. Now I pass it off to Faisal to conclude our recommendations.
Thank you, Josh. To summarize, the partnership with Humana provides Dispatch Health with a national presence to serve more patients with a company that knows about healthcare affordability. Intermountain Health, our current partner, brings regional power with a shared mission to quality and growth. In partnership, these deliberate collaborations will aid Dispatch Health in increasing services to more patients, scaling efficiently, and realizing the mission of delivering reasonable, accessible healthcare to anyone who requires it. Join us in making a difference. Help people thrive while building success with Humana and Intermountain Health. Thank you.
Thank you.